Good afternoon, everybody, and welcome back after the lunch break. We hope you enjoyed our morning session, and as we mentioned before the break, we've got a really great afternoon session focusing more on health systems, that international dimension that we're exploring. And because, as we heard, everything's interconnected, we have to think globally. As many of you will know, I'm Fiona Adshead. I chair the Sustainable Healthcare Coalition, and this is our stakeholder engagement meeting. Just to remind people that the purpose of the meeting is competitive collaboration, and we're really here to kind of share ideas, connect people, and progress action on sustainable healthcare. So you're very welcome to our afternoon session, and we look forward to a really great conversation. We will, as Keith noted this morning, be recording the session because we know that whilst many people can join us for the whole day, some people can only join us for part of it. So we're always very keen to be able to share presentations that people have missed. And just to remind you all that we'd love to hear your questions and also your comments in the chat, as it's always a great opportunity to exchange ideas, as we did this morning. It was fantastic to see the debate provoked by people's conversations, presentations, so thank you very much. As Keith is showing us on the screen, as I mentioned, we'll start off with WHO ATTACH, then look into what's happening in the health system in France, look at really what the opportunities are within the UK for policy levers for decarbonisation, and then look more broadly at the European agenda with Kirsty Reid. And then after the break, we're really going to be focusing on a lot of what we do, and also we partner with others on about sustainability tools, both in terms of clinical trials, but also care pathways, and then different approaches and different ways of modelling change. We'll hear from Forum for the Future, who will be sharing the Health Coalition and Climate Health and Coalition's tools that they've developed, and also hearing a broader research perspective from Martin Farley. So that's really what's coming up. But without further ado, as he has joined us now on the call, it's a great pleasure to introduce one of our colleagues. Novo Nordisk was mentioned a few times this morning, so it's very timely that Niels Lund, who is their Vice President for Climate and Health, is joining us. Niels was lucky enough to be part of the SMI Sustainable Markets Initiative representation at WHO ATTACH, and he's going to talk to us about what it was about. I was lucky myself recently to be in Spain, and the lead for sustainability in the Spanish ministry was saying that it was quite a remarkable meeting because the whole building was taken over by the delegates. They'd never had quite such a big meeting. So Niels, we're fascinated really to hear about your experience of it and how things are really joining up now globally. Over to you.
Thank you, and thank you for the opportunity. And you're quite right. I felt actually a little bit lucky being and also slightly being the odd one out as a representative of the private sector. And even though I'm from Novo Nordisk and lead our climate change and health work at our end, I was representing the broader coalition of the Sustainable Markets Initiative at the WHO ATTACH meeting in the beginning of March. And so you'll get the slides afterwards, and I've embedded a few links here and there, so you can get the full. You can embed yourself in the full meeting, because there were actually recordings of them if you have time in your life to doing just that. But just few words about what ATTACH is. It was is a coalition of now 82 governments around the world who were formed at COP26 in Glasgow when the WHO issued their first report on climate change and health. And the idea is for this collaborative network under the WHO, or hosted by the WHO, is to support countries in delivering on these climate change and health commitments, and promote climate resilience and health sector decarbonization. And with 82 governments, there is obviously a wide array of capacities and competencies and resources and the lack thereof amongst these many members here. But they've organized around 5 major working groups: climate resilient health systems, low carbon and sustainable health systems, supply chains, financing, and then finally climate action and nutrition. And they've had a number of interactions and meetings online over the course and in these working group over the course of the last couple of years. But in the beginning of March, the Spanish government hosted the first face-to-face meeting of this alliance, which is a I think a big market exchange, I would say. At least that was the kind of the feeling. There was a lot of sharing of experience and an openness to new views and best practices around the world. But if I may, just as an observer to this, and here representing the private sector, I've really felt that. Also from the speeches and the ones who are in the different panels here, that there's a really big focus on developing and also implementing global and national action plans. There's a huge unmet need in all of the aspects that lead into national action planning, benchmarking, target setting, action planning, and funding. So there's no money. Very few, very little capacity, but a great willingness to work with this and work around this between governments and with governments and academia most particularly, and with a number of institutions and NGOs in that mix also. So it's also a forum with a lot of energy, but also really starting in many places from scratch. But with the last 2 COPs, both the one in Glasgow, or 3 COPs, the one in Egypt and the most recent one in Dubai, the climate and health agenda has unfolded quite a bit most recently. And there was a lot of time spent, and there was a second point on the unresolved funding challenge to drive climate change and the health agenda in the global south ahead of COP29 in Baku. So when we get to COP30 in Brazil, both the structural issues and the institutions as well as the financing things should be all gelled together and provide that opportunity for governments to both organize around driving health systems decarbonization, but also have the funding for that. A personal view here is that I think that is still quite optimistic, but if you don't try, you probably won't get there. So it was very much a meeting of like-minded and government representatives with a number of institutions in support of that. But I think there was also that was really nice, an openness to collaboration with the private sector, including the SMI, on the aspects where private sector meets public sector, for example, in the health system, both on the supply chains, but also collaboration around how can we decarbonize patient care pathways. And as such, it was a good opportunity to be there and talk about how we, as the coalition of companies and other institutions, work together in the SMI to drive those changes in the supply chain, but also a dialogue with other private or public-private initiatives such as UNITAID and the International Committee for the Red Cross and others who work in this field between public and private here. To the right, maybe just a reminder of what the 5 major tracks of the the Sustainable Markets Initiative focus on. And there is some overlap between those initiatives and also the ones of the WHO attached group. And it's also nice to see that the WHO has recognized SMI as a collaborative partner on this. And that will actually, if I may just make a small add for a side event that we are organizing in the context of the World Health Assembly in May the 28th, where we have invited a number of relevant stakeholders, including the National Academies of Medicine, the WHO, and others to talk about how we might decarbonize clinical trials and patient care pathway. And I think on both sides, certainly on the side of the SMI, there is a great appetite for and interest in collaborating across the board. And this is where I think the SMI, which started out as a UK-focused initiative, has the opportunity to be a maybe trailblazer is a big word here, but one that will develop tools, and we might come back to what some of those are, but also tools and approaches and also facilitate investments in some of the things that actually will help to drive health system decarbonization. And I think it's a good signal that there is collaboration here, because I think nothing will change in isolation. There will be a need, as someone said earlier in the day, for these types of partnerships. And the world won't change with a side event in Geneva on an average Tuesday afternoon, but it is a symbol of that collaborative spirit that then between the meetings and the events where we can actually do stuff and find ways to solve the challenges in practice. So I think that's probably what I want to say about this, but I'll of course be happy to take questions here and again also let you know about I mean, if you're interested, click on the header in the presentation that I hope Keith will be sending out, because that has a link to the WHO attached community where you can see all of the work that they're doing in the work tracks here and either contribute or be inspired. Thanks.
Great, thank you very much, Niels, for sharing that perspective, and also highlighting what we're going to be doing at the World Health Assembly as well, to kind of keep that momentum going that you were describing. Are there any questions for Niels? I mean, perhaps while people are gathering their thoughts, I just wondered, Niels, I mean, one of the things that we often hear in the UK is that, this is very much needs to be a global issue, and that it's not going to work if just one or two countries are interested in this. I mean, what strikes me about the initiative is that people might be at different stages in the journey, but we can now truly say that this is a global health issue. I mean, what was your perspective having been to Spain?
Well, I thought I think there's a north south. It's not a divide, but I think there were kind of two types of discussions here. One was really the importance of bringing this agenda also and embedded in national health system planning in many developing countries. So that is that is one, and that is really both important but also really challenging. And then I sensed probably particularly amongst the representatives from the UK, from France, the Netherlands, Spain, a group of like-minded countries that might approach it from slightly different angles, but broadly want to go in the same direction, and then the methodologies that they apply might be different. And here I sensed a a genuine curiosity and interest in collaborating with both between each other, but also with private sector, with organizations and others to learn about how we move this forward. And of course, many of these health systems are more developed, have capacity to address these issues, and are eager to do that. I think it was interesting amongst the government representatives that were were speakers at the event. It was more different than NHS, if you understand what I mean. And so it was more the development assistance community, trying to make sure that this is a global effort, and that funding and institutions also are on track to do that. But I, in many of the work group sessions, it was the ministries of health and the health systems that carried that dialogue forward.
Yeah, no, understood. And I guess the fact that the World Bank has shown interest in that should help. And it's obviously sort of regional related organizations for development across sectors of the economy, because I guess one of the sad things is that whilst healthcare systems might be engaging in different ways, often the lower income countries are the ones that are experiencing the impact of climate change first.
And I think, come to think of it, the Rockefeller Foundation also lurked around in the corners here and there, and they're also on stage and speaking about it. And I think the meeting also allowed for a discussion not just of mitigation, but also on adaptation. And the Rockefeller Foundation has committed $1 billion over the next many years to climate change adaptation. And I think they were on the lookout, where could they meaningfully apply those resources. And I think it's probably also in many low resource settings that we will see the need for some planning and some systems around climate change adaptation policies and actions that we probably in this part of the world have less of a need for.
Yeah, no, absolutely. Jürgen's got a question. I mean, what momentum to decarbonize the healthcare system do you sense, especially in the US, as it's the largest pharma market on the globe?
That's a good and maybe also a political question. So, but my take on it is that I saw that the National Academies of Medicine just launched a big initiative. Was that last week or something like that? And did it together or in the context of Kaiser Permanente's big health meeting there. And I look to Kaiser Permanente as a super interesting, really progressive organization. In many ways, quite sorry for the stereotype, quite European in the way that they're thinking about many of these things, but actually really driving a lot of efforts, both in climate change mitigation, but also adaptation, which is when you compare the US to Europe, the US is probably the US population is more at risk. Health inequity is larger. They are more prone to heat stress. They have fires at a scale that we do not, and therefore, I think there are a number of factors where climate change adaptation measures are probably more needed, and also is greater in focus in the US. When I look at the engagement of pharma companies, which I know is not the question, but I might answer that question anyway. I see less interest among some of the bigger US pharma organizations, and maybe that's linked a little bit to the high degree of political heat that also underlines this debate in the US about whether climate change is real or not. When you have them on a one-to-one basis, many of them will be engaged, but I sense, and that's personally, I mean, I don't have any statistics for that, but I sense a a bit of a reluctancy to go into this debate and in these partnerships more broadly. But Kaiser is the, I wouldn't say the odd one out, but one that is really moving forward here together with the National Academies of Medicine.
Yeah, and they were kind of leading it. I remember with their Emerald system about 15 years ago. Alethea, you had a question.
One thing for me first is a little bit of an opportunity because I've got so many people in the room. So I think one of the things that I do a lot of work on is trying to sort of look at sort of the supply of medical gases. And one of the things I've found is that there's a huge amount of system loss, and the methodology is pushing through a lot of English-speaking countries because obviously that's the first penetration. So just to give an example, system loss for nitrous oxide for a normal hospital would be between 700,000 to 1.1 million litres, which is quite high, and that's close to 100% loss. I was dealing with one hospital in Canada that was losing, this is in a year, 11 million litres, one hospital. So I'm quite keen to get this message out because N2O is a long-lasting molecule. It hangs around for about 300 years. And I'm just wondering if I want to sort of try and engage with those 82, I think you mentioned 82, maybe I misunderstood 82. So I mean,
82 governments,
yeah, I'd really like to get that message out, and it's an operational model. So look, I'm happy to take this offline, but this is a really real opportunity to get all the clever people in the room to say, how do I do this and quickly, because it is it's an intergenerational pollutant. So the sooner we curb it, the better. So any help, because at the moment I'm just talking to lots of people and I need to stop doing that. I need to just kabam it. I want to bake all my muffins at once, you know, Fiona. That's what I really want to do. So, yeah. And then the second thing on the American thing, I think the American thing is interesting because they have that moral hazard with prescribing, isn't it? So the moral hazard within their tier system of over care, over management, which doesn't necessarily deliver better health outcomes, and that is sort of runs in parallel, you know, is proportionate to their sustainability problem or So anyway, it's just an interesting chat. But
Alethea, I mean, you're welcome to reach out. I put my email in the chat, so you're welcome to. We can take that bilaterally afterwards, if I can help.
No, thanks, Niels. That's great. And I think what I would say is obviously politics impact, I think, on many countries, as we all know. And I think that part of what those of us in the healthcare system who are passionate about this agenda can do is kind of hold a steady, practical level of action across time, which means that the solutions are there when the political system begins to change. I mean, certainly that was true on the social determinants of health agenda during the Bush era. Once Obama was elected, there was much more progress for a whole range of reasons. So who knows? I mean, there are all sorts of possibilities, but I think that's the power of our kind of collaborations, to keep it practical, keep tools that people can use, and look at things that I think are less controversial, like health systems adaptation, because that was one of the first things that WHO focused on in Europe. And that brought a lot of countries together because they could see the immediate need without needing to get into perhaps more controversial territory. So thank you very much, Niels. I know that we're going to be hearing from you later on one of those tools that you mentioned. And so we look forward to hearing more from that. But thank you very much for representing us so ably, and also for bringing that experience back to us. It's really very much appreciated. Well, we're really delighted to have today to welcome Laurie Moreau, who is a lecturer at the École Haute Études en Santé Publique in France. And I think certainly I was at an OECD meeting for business a few months back, and your French colleagues were telling me how much France is leading in Europe. So we were very curious, and we wanted to hear more about what you were doing and also to get your perspective. So over to you, Laurie. Thank you so much for joining us.
Thank you so much for having me today. So I'm Laurie Moreau. Indeed, Hélène told me that we should meet together, and maybe I could attend to your partner engagement meeting. So I'm very happy to be here. Actually, I have multiple roles, and maybe it is interesting for you. Sorry, I didn't speak English for some months, so excuse my approximate vocabulary. But actually, I'm a lecturer in the French School of Public Health, but I'm also a project leader in a think tank named the SHIFT Project in France, which is specialized in decarbonization of France and Europe. It is, in few words, a bunch of very talented engineers that work on decarbonization of the economy for very low salary, trust me, related to their skills, but a lot of motivation and a lot of expertise, because the president of the think tank is one of the creator of the French footprint methodology, carbon footprint methodology, named Jean-Marc Jancovici. And so it's very interesting for us to study the carbon footprint related to the physical flows of the carbon, and not only the monetary flows related to carbon. And I could explain what I want to say, saying so. And I'm also a shareholder of a research chair named RESPE, for Resilience in Health, Prevention, Environment, Climate and Transition in the French School of Public Health. So, and I'm also an expert for the French Ministry of Health, who launched last year the French economical planning of the healthcare system. But actually we have in France a general secretary of ecological planning. So we do think now in France that ecological transition cannot truly occur if we don't have a kind of planification at the national level and the European level. So it is a part of our state of mind and the way that we think. So maybe I could explain to you how it works with our French healthcare system. So just to begin, maybe to remind you very few, first, we treat about carbon emissions in that think tank, the SHIFT project, but of course there is many other impacts, environmental impacts, and it is very important to take care about carbon emissions, but also to take care about very multiple kind of pollutions. But our specialty is about carbon emissions, but I also want to remind you what maybe it could be one of the most important, unfortunately, topic in the next years now. So is it really that bad about climate change? Today, actually, no, it's not that bad today. So climate change is not our main problem today. Maybe it could be a bigger and a bigger problem in some countries around the equator, for example. So in India, China, Africa, and maybe around Mexico, etc. You can have countries that have big problems today with climate change, but it's not even the biggest problem for everybody today. But that will certainly change in the next years, because for two reasons, as Professor Robert Votard, which is the co-chair of the Group 1 of IPCC, said recently, that the climate change is really fast, and you cannot go back. It's not reversible, okay? So even if with carbon capture technology, which are not mature at all, it's not reversible for the carbon we have already emitted. So we can just have stabilization with net zero today. So it's very important, because what you can see from last year, for example, is here you have the dashed line, which is the average temperature for the last 30 years. And the orange line is actually the temperatures. I don't know if you know that data, but it's from the main university, and it's about the average temperature all over the world on the air surface, the surface air temperature. And you can see, actually, it's not even on the top of the last records. It's much more than the top of the last records from the middle of the last year until today, actually. That doesn't go down, okay? So something happened. It's probably due to El Nino effect, that it's a natural phenomenon that can increase the climate warming, but we don't really know what is happening, and what we know is it's not a good news at all, because we are far from the average temperature. We are even far from, in some cases, the last records. And for example, for the sea surface temperatures, it's even worse, actually. So you can see in 2023, it was very high, related to here is the average temperature, actually. And it was very high and very high related to last records. And now in those days, in 2024, it's also very high. So as we know, the IPCC indicates the possibility of a global warming up to 5 degrees, but actually even 3 degrees, it's very, very dangerous. As you can see, at 1.5, it can be difficult in Europe and USA and many parts of the world during summer. So 3 degrees, it could be out of control after 3 degrees. So we must stop before 2 degrees. It's an imperative. It's not something we can discuss. And after that, we have the healthcare sector that contributes a lot globally. And over 60, even more than 50 countries today signed this United Nations commitment to resilient low carbon health system. So many nations are now committed to have a low carbon healthcare system. So the resilience of healthcare systems must guarantee, of course, the continuity of care. We are all agree about that, without overwhelming finances, damaging ecosystems, and depleting natural resources. So when I hear and I agree that a treatment is sustainable if it's efficient, I totally agree. It's indeed sustainable if it's efficient, but if it doesn't take care, it doesn't take into account the impact on climate change, this collateral damage, so it is not efficient at all. It is suicidal in a way, okay? Because we miss information when we think a treatment is efficient without taking that into account. So it's really important to have the dual strategy of mitigation and adaptation to climate change. So in France, with the help of the SHIFT project think tank, we have calculated the carbon footprint of the healthcare system. So sorry for now, we just have the French version, but we will translate it soon in English, of course. And we use that scope for that study. So we look at everything that is related to the patient, but not in an economic way. We did calculate the physical kilometers, the physical liters of fuels, the physical square meters that you need to heat, etc., etc. So we had that methodology based on physical data as much as we could, but we all had a part of our data based on a monetary ratio, as we had for example, for pharmaceutical products and medical devices, because the reason was we didn't have the life cycle assessment and we didn't have emission factors related to physical flows for these products. So the result is this one. The carbon footprint of the French healthcare system is estimated around 50 million tons of CO2 equivalent. It's 8% of the national footprint. The majority of this emission are indirect emissions, so it's not a surprise for you probably if you have already seen other estimation for the healthcare sector. And half of this emission are for pharmaceutical products and medical devices. Here you have the distribution of the emissions. So you can see we have around 11% for energy consumption, around 30%, 40%, that depends what you count, for transportation, around 11% for food, for catering, and around 8% for capital assets. And in these capital assets, you already have 4% for digital tools and digital equipment. And that is interesting. With the French Ministry of Health, we have published in 2021 a report about the evaluation, the environmental impact of digital health, because we think today digital health is sometimes thought like a solution for pollution. And as we saw before with your presenter, that it's not the case. Digital health is also a burden for the environment. So it is very important to anticipate this time. We need to anticipate and to know what will be the emission of this presenter, that it's not the case. Digital health is also a burden for the environment. So it is very important to anticipate this time. We need to anticipate and to know what will be the emission of this digitalization of healthcare. And you have less emitted categories, like, for example, anesthetic gases or waste and other services. And finally, the emissions are dominated today by the medication and the medical devices purchasing. So what we propose is what? This is a diagnosis, but we need to move forward. So we need to have a roadmap until 2050, as many countries decided to have one. And what we proposed, it's not only to have, how can I say that, what we want to do in the next 30 years, but what we can do. So we calculated the possible carbon saving for each action that we proposed in the plan. So what we can see is, with all the action we can do in electricity consumption, insulation of buildings, etc., transportation, on food, for example, if you eat more vegetables, less meat, etc., waste management, you can have 25% of reduction. So you cannot have more, or maybe you can have more, but we are like optimistic but pragmatist in that report. So probably you cannot have more than 27, let's say 30%. And don't look at this part for the moment. This is the first scenario. And we can say also in France, we have a lot of medicine consumption, and we also have a lot of waste in medication consumption and medical device consumption. So we can say that it is possible to reduce volume just by being coherent between prescription and conditioning. Sometimes, okay? So this is what we call by reducing volume here. And you can see at the end, it's less 35%, but the objective of Paris Agreement is less 80% for everyone, every sector, every activity. And we cannot say that healthcare is very important and we don't have to reduce because the other sector can reduce instead of us. That will not work. You know why? Because transportation is very important. Food is very important. All the industries are very important, you know. So it's very complicated. What we must say is everybody must engage in that. In that a project of decarbonization. And have the same objective of reduction. And after that, if it's physically impossible, we have to have a discussion. But before that, we have to have the same objective. So all the industry in France have the same objective, less 80% of emission. So this is what we ask in these scenarios for the pharmaceutical industries and medical devices producers too. If you have less 80% of emissions at the production, what happened? So it's very interesting because at the end, all the French healthcare sector reduce its carbon emissions of 70%. So we almost reached the goal. And to reach finally the goal of decrease of 80%, we think it's very important to work not after, but before. So what it is, finally, it's about the right care, the health promotion, and the prevention. Of course, we are not the first one to tell that. For example, Andrea McNeil talks a lot about this in one of her papers. She says, first, you have to do prevention and health promotion. After that, you have to choose wisely to do the right care. And finally, you decarbonize what is left. So it's not what we did because we wanted to see if it's possible to decarbonize the healthcare sector as it is today, but actually, probably it's not. Physically, it's not. So we need to have also prevention and health promotion as support of this decarbonization policies. So it's very important to have systematic evaluation of public policies to prevent potential harmful environmental risk, to promote projects that benefit to health, etc. And developing physical activity involve the professional world. For that, you need to have a special professional training, and today it's not systematically the case. So all of these recommendations today were more or less present in ecological planning for the French healthcare system. So this is an official document named Planification écologique. And you have 8 specific fields that are investigating. So the building and energy management, the health products and industries, and health industries, sustainable purchasing, eco-responsible care or sustainable care, waste management, training, mobility, and digital technologies, because as I said before, I think it's just the beginning, unfortunately, the beginning of the pollution of digital technologies. So it's very important to anticipate. And we must not forget the essential role of prevention in this decarbonization of healthcare. Finally, because as we said, we did the math, and we see that it's certainly not possible to decarbonize without having a strong policy of prevention. I don't know if I have time, but if I can push you for 5 minutes. We also did a specific work on emission factors of medications. Why? Because today, probably you know that we don't have the data. We don't have the life cycle assessment of the majority of medications and medical devices. We know it's not easy. We know that a life cycle assessment can be expensive for the industry. And beyond that, that can be difficult to find the real data. Okay, but it's very, very important today to focus on that question and that issue, because as you can see, we have very different emission factors from the place you are. Actually, it's evolving in time, but that can be normal because you have energy efficiency over time, so that can be normal, but it's also evolving depending the place that you are. And maybe it's sometimes it's due to the perimeter that you choose. Maybe sometimes you take into account what we call scope 1 and 2, and sometimes you take into account scope 3. And so you have very different methodologies, and the monetary ratios today are not accurate at all. It's a reality. So we do need to have more information. For what, for example? So by the way, you can find this information in a technical note that we have published last year. So why? We do need this information to know at what stage, for example, do the GHG emissions of medicines come from, if we talk about medicines only. So production phase, for example, for this antiviral, or the use phase, for example, for anesthetic drugs, or maybe that can be from the packaging. So this is the case of morphine, okay? or that can be also the electricity consumption. And that also depends the methodology that you use. You would not look at exactly the same criteria depending on the paper and the different life cycle assessment that you can find in the scientific literature. That can be also due to use of solvents. This is the case of ibuprofen. Why do we need to have this life cycle assessment? First, to decarbonize the production of medicinal products. So have we seen just before, if we know that the problem is during the production of the APA, so we can focus on this specific stage, and for example, substituting new non-renewable heating fuels with renewables, okay? We can see also that by using, for example, recycled solvents, you can save a lot of carbon emissions versus virgin solvents. We also need this life cycle assessment to compare to medicines. So this is the examples that we have seen this morning, a great presentation about asthma. So this is an example about the inhalers. So you have great differences between the dry powder inhalers and the inhalers with aerosol. You also have, of course, the impact that can be really decreased and divided by 2 if you produce in USA versus in China. And in Europe, it's even less. You have the same example with paracetamol here. When you do the administration with oral tablets, is much less emitter than if you do it by intravenous, okay, because you don't need the same equipment. And finally, you can also use this life cycle assessment to compare 2 care pathways. And that is interesting because calculating the carbon footprint of medication, that can help us on different reasons to compare 2 care pathways. First, optimization opportunities. So that can help to reduce the environmental footprint, by targeting some specific stages. So that can optimize the prevention, diagnostic, therapeutic, and follow-up phases, for example. They can help to the stakeholder engagement, because if you have the holistic vision of all the care pathway, maybe, you know, the different stakeholder can be included in the decision and can better understand the global impact of their decisions. And finally, you have the contextualization of data. Medication may have very different environmental footprint depending on their use, as we have seen that just before. So comparing care pathway footprints allow for contextualization of this data and taking into account the specificities of each clinical context. So here are the references and further reading if you need, and thank you for your attention. And I hope it was understandable, unless my English is terrible, as you can hear.
No, your English is fantastic, and better, I'm sure, than everybody else's French. So thank you so much for that. It was really interesting, and as you'll see from the chat, you sparked quite a lot of interest, and people would love to have the reference to your report, even if at the moment it's in French. I suspect people's written comprehension's better than their oral comprehension of French, so it'd be fantastic to have the link for that. I guess there are a couple of questions just to pick up on before we have to close because of time. The first one was, how is the French healthcare system going to kind of implement this and work with suppliers to reduce the carbon footprint?
Yeah, today company to propose methods to calculate carbon footprint, because today for medications, because today everybody can have his own carbon footprint calculation methods, and that's a difficulty because it's, as I said, it's difficult to compare.
Yeah.
Even when you have the result, the quantification, it's difficult to be sure that you can compare that quantification to another quantification, because maybe it's not the same perimeter, etc. So the French government, and it's I think it's the Minister of the Industry and the Minister of Health, they asked for a global methodology for carbon footprint of medications, and they will ask to suppliers to answer to fulfill a document based on this methodology to have transparency about carbon footprint of their products. Of course, if they don't have today, they will have little time to gather the data and to get more information. But it is asked today, so not today, but in 1 year, it will be asked to have this information and to fulfill a specific methodology.
But, okay, fantastic.
So this is the first step. Second step is now when we will have all this information. So of course you can see we plan for the future, as I said. Of course we will begin to compare, and we can have a classification little by little to ask the different suppliers, are you able to do like your competitors on that topic, because we think it's interesting. It's very interesting to have this production mode that is less emitting. So we will, of course, use this information to motivate the producers to bring innovation in this carbon emission.
Great. Well, thank you so much. And I think your emphasis on patient care pathways is if you're able to stay with us, you'll hear in the next section some of the work we do as a coalition on care pathways. It would be great to continue the conversation, because I think we've only just begun the conversation about all the things that we could learn from you. So Laurie, thank you so much for sharing your experience, your expertise, and it's fantastic to see what you're doing, but also what you're planning to do in France. So we'd love to keep the conversation going and continuing to learn from you, and very much hope that we can form a strong collaboration. So thank you so much for your time today. Really appreciate it.
Thank you very much for listening. Thank you.
No, it's our pleasure. So we now turn back to the UK and our own healthcare system, and we're really delighted to be able to introduce Catriona Callan, who is one of the Greener NHS clinical fellows as part of the Chief Sustainability Officer scheme, and she's a fellow with Rose, our own fellow. So great to have you today. I think one of the wonderful things about the UK system is that we're always very good at analysing and making sure that we keep people on their toes and look for opportunities for improvement. And the Health Foundation has done some fantastic work to look at what are the levers and how else might we do. And your recent futures presentation, your lived experience of what a healthcare system of the future would be like, your model was fascinating. So Catriona, over to you, and we look forward to hearing your analysis.
Thanks very much, Fiona. It's great to be here. Yeah, I'm Catriona Callan. I'm a GP registrar by background. This year, I'm one of the current clinical fellows to the NHS Chief Sustainability Officer, and based at the Health Foundation, where, as you mentioned, Fiona, we've been doing various pieces of work on environmental sustainability of healthcare in the NHS, including quite recently an immersive installation imagining a day in the NHS in 2036 when it's near that goal, and there's a piece on our website about that. But today I'm going to be talking about how policies shaping care delivery in the NHS can support decarbonisation, and setting out some findings we have at this stage from talking to stakeholders across the system and doing some policy analysis work. My ulterior motive is also to invite your discussion on these findings so far, and to hear what you think, especially given the really strong international perspective here today. I'm very interested to hear how this sort of resonates or compares or contrasts with your experiences in other health systems as well. So yeah, my primary focus has been the NHS in England here. And we've done this to set out what we know so far about health policy and to sort of work out where the gaps are. And this is where we hope to contribute more in this space. So I'll come on to that as well. So just a bit of background, first of all, the Health Foundation is an independent charitable foundation. It's not part of the NHS. It's committed to bringing about better health and healthcare for people in the UK. And it does this through a range of means, from in-house research and analysis to commissioning research or funding frontline improvement projects, and overall seeking to positively influence policy and practice. And the background to this project. So as Fiona mentioned, the Health Foundation has been increasing its focus on the environmental sustainability of care. And this is a piece we published last year entitled Net Zero Care, What Will It Take? And this was developed through desk research and conversations with over 50 stakeholders from across the NHS in England. And it really sought to set out the need for a focus on clinical care delivery if we're to achieve the NHS's net zero aim of 2040 for the emissions it directly controls and 2045 for those it influences. So ultimately, and this is, I'm sure, the key message that we're all aware of, we need to reduce demand for healthcare and absolutely minimize the emissions that care does generate. And this piece sought to also illuminate the alignment of the drivers of sustainable care with other health system priorities. So this is how we sort of framed the drivers of sustainable care and used examples to illustrate how these drivers, which is very much based on the Centre for Sustainable Healthcare's pillars of sustainable healthcare, how they support other health system priorities like quality, and equity and efficiency. And in this piece, we also sought to set out what we need to focus on next if we're to achieve net zero care. And policy, as I said, is what I'm going to go into a bit more today, but I'll just briefly touch on the other areas of focus we highlighted. The first of which was to invest resources to shift to low carbon care models. And a lot of this is actually about human resources. So many stakeholders again and again referred to the problem of, in the NHS at the moment with high pressures, the difficulty in freeing up capacity of staff to bring about sustainable change at the front line, as well as increasing the capability of staff to do that. Secondly, putting sustainability at the core of good leadership and having this as one of the key priorities of leaders across the system, recognizing the alignment with other key healthcare goals. Ensuring policy levers are used to drive progress, which I'll come on to. And finally, supporting research and innovation to enable faster decarbonisation of care. So identifying where change is most needed, evaluating it and scaling and spreading it across the system as well is also part of that. So within policy specifically, what do I mean by policy levers? So when we think about any care pathway, care delivery is shaped by a vast array of directives, guidance, incentives on health system providers, leaders, and staff. These can be grouped in various ways. Here we've been using the European Observatory and World Health Organization's categorization of policy levers according to what what function of the health system they support. So governance and oversight, funding, resource generation, and shaping service delivery. So just to give you an idea of the types of things I'd group under each of those in the NHS in England. But these policy levers were not designed with sustainability in mind. And so while there's been examples in recent years of sustainability being incorporated into policies, so for example, the contract for providers in the NHS now has now requires providers to undertake certain reporting duties and to undertake certain actions, such as having a green plan. And the Care Quality Commission that regulates providers is also going to look at sustainability in its revised assessment framework. So these are examples of progress, but these are just a tiny portion of the wide range of levers in use across the system to shape care. So overall, we don't have a very clear idea of, at the whole system level, how policy is helping or hindering progress towards the net zero healthcare goal. So the goal with this work was to map out the current landscape, to see where we are, and to get an idea of where there is helpful or hindersome activity going on, based on what stakeholders across the system think, and to hone in on what they feel some of the key considerations should be for policymakers and those seeking to influence policy going forward to make policy more supportive of sustainable care. So I'll share with you now some illustrative examples in each area, just to give you a flavour of the kinds of things that came up. So first of all, within governance and oversight, so this is all about sort of regulation, standard setting, strategy, long-term vision. So as I mentioned, the Care Quality Commission is now including environmental sustainability, although it's not totally clear so far the sort of quality standards that will be judged, that providers will be assessed against. Another example of a supportive lever here is national medicines optimization opportunities are set out by the NHS in England, and integrated care systems at a regional level need to choose between those to progress within their local areas. And many of these, while they don't explicitly necessarily cite their sustainability benefits, which is a recurring theme with all of this, do align with sustainable care. So for example, reducing the course length of intravenous antibiotics in order to reduce time spent as an inpatient in hospital, or moving towards high quality, low carbon inhaler therapy for respiratory conditions. Then thinking about levers that stakeholders highlighted as there being little activity so far, or sort of actively they felt potentially slowing progress. Some of these related to medicines and manufacturing authorization at the very upstream level. So authorization processes for new medicines and technologies not currently incorporating environmental impact, and issues with reformulation, and there being regulatory burden in order to reformulate, even to achieve sort of sustainability benefits or reduced environmental impact. Then thinking about funding levers, so there are some positive examples in financial incentives, which again may not explicitly cite sustainability as a benefit, but which may incentivize high quality and preventative care. So for example, the quality and outcomes framework in general practice, which financially incentivizes things like diagnosing diabetes in the population and seeking to have a certain proportion of patients with good levels of control of their diabetes. So that's obviously trying to avoid as many complications as possible. There was, of course, the now discontinued financial incentives in general practice that were more specifically focused on low carbon care around inhalers, which have now been discontinued. And there are some sort of analogous examples in secondary care of financial incentives for quality care that we could see as aligning with sustainable care, although not necessarily explicitly so. In terms of policy levers that may be hindering the transition, any payment structure that sort of incentivizes activity, particularly in the more high carbon intensity acute sector, is always going to be in tension with sustainable care. So in the NHS, that's things like the payment by results structure, which obviously seeks to address priorities like access and waiting lists, but because it incentivizes volume in secondary care, it is in tension with the need to shift focus to prevention. And then another example of a lever that's maybe not aligned, but not particularly an active barrier to sustainable care is things like the tariff, so the cost that the NHS pays to providers for carrying out certain activities, like procedures, investigations, outpatient visits, and these tariffs don't currently take into account environmental impact or sort of align with the key priority areas at the moment for sustainable care. Okay, so resource generation, I think we're going to hear more about this later as well, the role of health technology assessments, and this is something there's a lot of academic literature around, teasing out the challenges to accurately measuring environmental impact. But there's a further challenge that is also probably plays into why environmental impact is not incorporated into carrying out technology assessment, which is how do you place value on the environmental impacts compared to the health economic metrics, particularly when that might be in tension with the individual cost benefit question. A supportive lever in this area, so shaping the resources available, infrastructure and supplies, is obviously the net zero supplier roadmap. And one that can be a hindering lever cited by stakeholders was infection prevention control guidance, or even the culture of sort of concern around infection prevention, even where the guidance might not specifically relate to this, but that was perceived as often delaying transition to the use of reusable items, even where those items are already available and even where they may already be used in other providers within the same system. And finally, other levers which shape care delivery on the ground, so perhaps shape workforce behaviour, national clinical guidance, so things like clinical guidelines, they can be seen as already very much aligning with sustainable care in that they seek to promote evidence-based, high-value, cost-effective care, so very much aligning with high quality and avoiding ineffective interventions, because they also give sort of do not do recommendations for interventions that don't have evidence to support them or have evidence of harm. But on the other hand, there's not a sort of systematic approach to considering environmental impact in the evidence reviews for these types of recommendations. And finally, another issue that many stakeholders cited was the challenge, again, in terms of capacity for the workforce to undertake sustainable quality improvement in their own clinical areas. So standing back from the whole picture and thinking about all the conversations we've had and the picture as a whole, beyond these illustrative examples, some main messages that we feel came out. The first is that, as I'm sure you got a flavour of here, it's overall quite a mixed picture, that there are certainly examples of helpful levers kind of across the board in terms of the different areas of health policy, but also of hindering levers and aspects of policy where sustainability hasn't really featured thus far. Another aspect is that among the supportive levers, some are more influential than others. So, for example, some policy levers which are supportive, which are quite binding in their requirements, are things like the NHS Net Zero Supplier Roadmap, whereas some that might have less strong influence could be things like the medicines optimization opportunities, where there's the ability for the integrated care systems to choose between those opportunities, or financial incentives, which are theoretically optional for providers to pursue. And that was kind of seen with the investment and impact fund. There was quite a differential spread of which groups of GP practices went after those financial incentives. And just to look at this in a slightly different way, among the most influential levers in the system overall, there's again quite a divergence in how much they support sustainable care. So thinking about some of the most influential policies, these could be things like the payment structure, the NHS standard contract. So even within those two, we can see that the payment structure hasn't really incorporated sustainability, whereas standard contract has. And that relates to another factor, which is that where sustainability was supported, this was often in its own policy, like the supplier roadmap, or sort of siloed, as it is in the NHS standard contract in a greener NHS section, without necessarily being embedded across the whole policy or thought of as a lens in wider health policy. And this, comes back to how I said many things didn't explicitly consider sustainability, but we sort of saw the alignment. But this might speak to, the sort of inconsistency in thinking about it. And so key considerations from conversations with stakeholders for more supportive policy in the future is something that came up is not just the need for individual policy levers to be supportive, but for there to be coordination across different policy levers to maximize the impact and achieve progress in specific areas of focus through the use of multiple policy levers, whether that be targets and financial incentives and requirements. But there's definitely a need to think broader than individual policy levers. Another was the right balance between direction from central NHS and local systems, for them to have the right amount of direction in terms of areas of priority and the actions to take that are evidence-based and high impact, but also enough autonomy to be responsive to the local picture about particular needs at that time and what's most feasible as well. It's very interesting hearing the last talk because data measurement was such a feature in many of our conversations, and more coverage of data measurement, and also more detailed data measurement being seen as an enabler for more specific and supportive policies. But also, people acknowledge that we need to take action now with the data we already have and try to be continually improving our system of measurement in order to properly evaluate the impact of policy, be alert to any potential unintended consequences. And there's also discussion about what's the best level of data transparency to have, and whether it's about different suppliers or different parts of the system, even at the provider level, what's the right level of transparency to sort of spur progress without creating cultures of fear. That's another topic of conversation. And finally, sort of consistency in framing sustainability along with other co-benefits in the system. and taking a consistent approach to considering environmental impact across all policies, as was clear from the kind of variation in how this is done currently. So this is something we intend to do further work on. This work so far is kind of intending to set the scene about what we know about the current landscape of policy levers in the NHS, but we're intending to commission more research in this area. And these are some of the kind of questions that have come out so far and potential lines of inquiry to follow. So, for example, learning from the past in the NHS, so for other priorities like access or quality or inequalities, what can we learn about the mixes of policy levers that have been used in a coordinated way to achieve those? What should we take from those? What should we avoid? Learning from international health systems, what are other places doing that has made more progress, and what can we learn from that? Developing a consistent approach and a shared language to considering sustainable care in policy, and thinking about what are the possible options for combinations of health policies to be more supportive of sustainable care, and what are the potential co-benefits and potential trade-offs of those combinations of policies. So this is something we'll be exploring further and narrowing in on where we're going to pursue this topic. So that's all I have to present, but if we've got time, I'd love to hear people's reflections on how they feel this resonates with their own experiences of working within the NHS or in other health systems, your views on what the knowledge gaps are to have better policy as well. Thanks very much.
Thank you very much. Fantastic summary and very comprehensive in terms of, you really picked up on one of the themes of the day, that this is about systematic system change at a whole different range of levels. It would be great to return to that as a discussion. Sadly, we're kind of up to time, but I think we ought to look for an opportunity for you to come back and have a conversation with us all at another point. I've just got one brief question. If I was a genie coming out of the magic lamp, and I could grant you one wish of one policy lever that you could pull with the maximum impact, what would it be?
Oh gosh, that's a big question. I would have to say nobody could argue with thinking that money drives change in the system. So I'm not sure whether I would be brave enough to say a specific thing, but at least for environmental impacts to be considered in all payment structures across the board.
Yeah, I think that's a wise choice because it can impact on a whole range of different things. So thank you. I will go back into my magic lamp, but really appreciate all your efforts on this, but also for laying it out so clearly for us. And we'll definitely have to return to your discussion points because I think therein lies a whole range of things. Julie, I'm going to be indulgent and just let you raise a question. I know you were really pleased with that. What would you like to say?
It was a great presentation, Katrina, and thank you for your work because I think it's much needed.
Thank you so much. I'll pop my email in the chat, and yeah, very happy to come.
Fantastic, and I think we should definitely return to a more useful and in-depth conversation about some of those levers because I think there's definitely a lot to learn there, and it's very comprehensive. So that's great. If I could then introduce the final speaker for this session before the tea break. Great pleasure to introduce Kirsty Reid. Kirsty is the Director of Science Policy at the European Federation of the Pharmaceutical Industries and Associations. And Kirsty is going to really give us a broad European perspective. So if that was the UK one, Kirsty's right in the middle of the action on making healthcare in Europe more sustainable from an industry perspective. So we're really looking forward to hearing your views. Thank you, Kirsty.
Thanks, Fiona. So this is not my work. This is the work of, I recognize a lot of names. So this is a work of actually those industry members even online today. So yeah, we had slides, we lost them. But what I'd like to give you is an overview of what's happening in Europe, just in general, with what we're facing with all the various legislations that are on the cards. So if we put it into show and we go to immediately to the next slide. Super, thank you. So what we have in the EU is the Green Deal. This was a strategy that was launched by the Commission in 2019, and it really lays out a large number of initiatives that they had underway to sort of cover in the mandate of 5 years that they're running now, which is coming to an end in June. But of course, the Green Deal will continue, and they will be setting the Commission's plans and bringing them forth to us soon after the new Commission term sort of starts. Will be in September. But a couple of years is a large number of legislative proposals. Now, just to give you some sort of perspective, what you have in front of you is what they proposed as a Green Deal. Let's say that, it talks about zero pollution, circular economy, about the climate neutrality. But if you're just looking at for example, the zero pollution, which is in the top right, that specifically calls out, for example, a sustainable strategy for chemicals, and then also looks into water and clean air. But that chemical strategy alone actually covers 80 different actions, and many of those are legislative. Some of them are non-legislative, but they're legislative proposals. So a lot of this is cutting across the whole of the European environment, but so impacting on a number of industries. But what we're seeing for the very first time is really the pharma sector is being pulled into a lot of it. So, and what I've done is at the bottom, you'll see some of the various strategies they have, or legislations that they have open now or they've been working on. But to scare you now is by going to the next slide. And this really shows you not all, but just some of the most dominant legislations that we're seeing. And this goes really to something I heard one of the previous speakers say, is about a lot of the discussions and decisions that are taking place are really taking place in a siloed approach. So we're not looking at how all these legislations will impact the healthcare sector per se, but at the same time, we're not understanding fully how they're going to actually make the change that they are being put in place. So there are some unforeseen consequences that will lead to some of these proposed proposals. And when we look at them in detail, some of them really, the idea is to have cleaner water or cleaner, less emissions. But what is being proposed will actually counteract that. So we really need to look at it a lot closer to make sure what is being put out in legislation is going to impact properly on the environmental sustainability. But at the same time, from a human perspective, we want to make sure that we also still put medicine on the market. And that's why it's very important for us to know that, for example, for ourselves, that the European Medicines Agency has a say in how some of these environmental and chemical legislations are being rolled out. But in this slide, you will see I've tried to show you that a lot of the decisions that are being put on the table will not be taken by that of the Medicines Agency, but will be more taken by the Food Safety Authority or the Chemical Agency or even the Environmental Agency. So on that note, it doesn't mean that we as an industry are not doing anything, but a lot of it is driven by having to follow the political agenda. But if you go to the next slide, what we're at within the industry, and so FPA represents generally the innovative pharma industry. And we've been looking at how we as an industry can be moving forward in obtaining these sustainability goals by improving what we're doing at the level of climate, improving what we're doing for patients, and also looking at ways for innovation and regulatory flexibilities. So if you go to the next slide, I'll start to give some details. And I know we're short on time, so I'll leave a bit of time for some questions also. Within FPA as an association, we drive and work with our companies to work towards a better circular economy, climate change. We look at water, so the impact of pharmaceuticals in the environment, and also we look at chemicals and how we can have more sustainable chemicals. And by doing this, either we work with our companies to bring out stories that of what they are doing in various case studies and white papers that we produce. And we had one last year on climate change, and I'll go into a bit of detail later. But later this week, and led by some of your colleagues online from Novo Nordisk, but we are going to publish our paper on circular economy, which really brings together a large number of examples of how companies, individual companies, are moving to or transitioning to circularity. But we also look at how we can better work in pharmaceuticals in the environment, and also have more responsible manufacturing, effluent management systems, and also how to carry out a proper environmental risk assessment to ensure that we are actually taking into account the impacts on the environment of our medicines. So that's work we do at an association level, but there's a lot ongoing that is either indirectly related to FPA, or it's actually led through various collaborations that our companies are involved in. And some of these you will be quite aware of. So we have Premier and IPI, which are actually innovative health initiative projects looking at prioritizing and identifying ways of improving understanding of the impact of pharmaceuticals in the environment. We have the Meds Disposal Campaign, which is really about informing the public about how to dispose properly of their medicines, because at least 10% of medicines going into the environment come through people's incorrect disposal of medicines. Then there are other initiatives like the AMR Industry Alliance, there's the Pharmaceutical Supply Chain Initiative, Manufacture 2030, that's actually called Activate. It's looking across the supply chain. You have Energize that was launched with one of COP27, I think, the one that was in the UK. And then we have an initiative, a take-back scheme, Returpen, which I've included here as one of the examples, which really shows how companies have come together to find ways to take back injection pens, for example, and find a new life for them, like even turning them into furniture, for example. So there are a large number of initiatives ongoing. So industry is really trying to drive and move forward and look at ways to decrease emissions, but also to make sure that they're decreasing the waste and reutilizing the waste that comes through the medicines. So next slide. So looking specifically at climate change and how we feel the pharma industry is looking at how to decrease emissions. Now, we realize that we have a big part to play here. It's been mentioned earlier about the healthcare system and how much they contribute to the emissions globally. And, you know, there's always a role to play either at on-site within companies. So that's what we call like scope 1 and scope 2 emissions. But then the most concerning is that of the scope 3, and that's really along the supply chain of pharmaceuticals. And our companies have been engaging in looking at opportunities to decrease their emissions. So we've run a couple of surveys with our companies over 3 different parts of I think 2017, 19, and 22. And what we saw was in scope 1 and scope 2 that our companies have been able to decrease their emissions when it comes to scope 1 and 2 by at least 10%. And this is quite significant. And a lot of them have put in various strategies to make sure that they have a plan in place to move forward. What they're doing now is really looking more at scope 3, because that's where, as I said, at least 98 or 89% of the emissions come through. And it's about working with suppliers and finding ways along the supply chain to decrease the emissions. And companies have set either long-term targets or they've set various short-term targets to be able to take this into consideration. We've also compared ourselves to other industry sectors, and we find that we're actually about 10 times lower in our absolute emissions when it comes to the sector. And what we show here is some of the case studies. So what we're trying to also do with our company is make a lot more of the information public, so that people are more aware of what companies are doing, and then also finding ways to collaborate with each other. And even later this year, we will see 2 innovative health initiative projects being launched through the Commission and with companies looking at becoming safe and sustainable by design, or looking at other sustainability activities. Next slide. We're also looking and take quite seriously the pharmaceuticals in the environment. It's become more notable more in the past few years of the impact that pharmaceuticals have on the environment. And I've already mentioned some of the ongoing projects and the awareness campaigns that we have running. But we've also developed guidance with our members to make sure that they understand and put in place the best, most responsible effluent management systems. And I've already referred to the looking at ways to improve what we are doing around environmental risk assessments, and working with the AMR Industry Alliance and also pharmaceutical supply chain initiative. So this is just a bit of repetition, but bringing together under the one topic of pharmaceuticals in the environment some of the ongoing initiatives. Next slide. What we also find is a lot of companies are leading in where they are actually implementing themselves various initiatives where they're trying to be ambitious, looking at how to be more sustainable by using different types of materials, or they're using different types of chemistry in the processes they use, or raw materials, or even in their manufacturing processes. But because we're quite a regulated system and also global, we find that there's some sort of barriers in the way. So what we're doing now is we're identifying many of these case studies where companies, individual companies, are putting forward solutions to drive forward to become more sustainable. And we're having discussions with the EMA, but also companies are reaching out to the FDA to also discuss with them how we can ensure innovation and these regulatory flexibilities, so that companies can move forward and not be held back when they try and implement various climate, environmental, sustainability goals. So we have a paper that's available online on the FPA website, and this is the basis behind some of these engagements that we have. I think that's the last slide. Yeah, so it was more to really give you we know as an industry that we're not there yet, but we know as an industry we have a role to play, because pharma companies are there to also protect people's health. But we also know that we are the cause of some of the concerns that are raised through climate change, through emissions. So we really have a role to play. And it's really good to see companies coming together, but not only as the industry, but they're working with regulators, they're working with organizations like yourselves to find opportunities to drive it forward. And they realize that in the pre-competitive space, there's a lot they can do. So this is not a competition the way it is a competition is who can do it faster, which is great, but it's really they see the benefit of sharing with each other the various best practices to be able to move forward. And I think that's really a benefit in how we can progress across the whole healthcare system.
That's fantastic. And you've given us such a wonderful oversight of what's going on in Europe. And I think your interrelated blobs with all the different activities go on certainly show activity. It's kind of like a Newtonian kind of system of movement. So fantastic to see that. I mean, do you think it's a function of timing, in the sense that now there are a lot of emerging initiatives or things that are in train, and eventually under the Green Plan they'll join up? Or do you think it's just because of the nature of the breadth of initiatives that are needed, it's just how it's going to be, all those unconnected, siloed activities?
Yeah, I think the biggest concern is that a lot of it came out at the same time. So when you're deciding on a new legislation, you actually don't know what the other legislation looks like because it's also under discussion and decision. And today, before joining this call, I was following the votes happening in the European Parliament because they're finalizing further legislations. And the problem is today is their final day, tomorrow, their final day to vote. All these, they actually have about 100 different legislations, not all on the environment, of course. But until they close up and they go into the European elections. And the only concern is the fact of rushing that through. I know there's been a lot of criticism, for example, against there was a delay put in the chemical legislation. It hasn't been put on the table yet. And my understanding is they didn't want it rushed through for this exact reason. So hopefully we will see that as soon as the new parliament's in place, we will see a new legislation coming through that can be worked at a proper pace so that it has the proper implications that it's supposed to have on sustainable chemicals in the future, for example.
Yeah, and it's great to see your talk because it's tied in with so many of the themes we've been talking about today. And certainly, I think after the very short break, we will return to issues around Scope 3, which you highlighted so eloquently. I don't think there were any questions in the chat, but just wanted to thank you so much, Kirsty. I know that you've juggled your agenda to be with us today, and we really appreciate that. And I think from looking at your breadth of publications, we've clearly got a lot that we can learn together on, and so we look forward to continuing that collaboration with you. So thank you so much for joining us today. It's really very much appreciated. Thank you.
Always appreciated, Fiona. Good to see you.
You too. So we're running slightly late, and apologies for that. I'll take full responsibility. What I suggest is that we have a brief 5-minute break